I'm Kara. I'm going to be your nurse practitioner student. I'm just going to perform a quick head-to-toe assessment on you. Is that okay?
Yes.
Alright. What's your name?
Hall.
Alright. Do you know what year it is, Hall?
2022.
Okay. Do you know where you're located at?
The clinic.
Alright. Perfect. Do you know what time your appointment was today?
10:30.
Okay. Who is first president of the United States?
George Washington.
Okay. And how are you doing today?
Good.
Okay. Patient is alert and oriented ×3. Speech is clear. A remote and recent memory are intact. Mood is congruent with affect. No apparent distress. Patient is upright and erect. No bodily odors. And dress is appropriate. Alright, let's start with skin, okay? I'm just gonna look at your skin. Okay, skin looks normal for ethnicity. I'm gonna feel you, okay? Skin is normal and warm, texture is smooth, skin is moist, no edema. Was there any tenderness?
No.
Okay, perfect. All right, I'm gonna do, skin is elastic. Let me see both hands. All right, capillary refill is less than 3, capillary nail bed is pink. I'm gonna club it over the fingernails. All right, let's move on to head. Head is normal cephalic, no deformities. All right, we look at the top of your head. All right, no scaliness, no dryness. Hair distribution is normal. I'm gonna feel, okay? Was there any tenderness?
No.
Okay, no tenderness, no lumps, no deformities. All right, let's go on to face. All right, face is symmetric. Can you smile real big for me? Can you frown? Can you puffer fish? Can you close your eyes really, really tight? All right, cranial nerve 7 is intact. All right, I'm gonna feel in your temporal and masseter muscles. You just let me know if there's any tenderness. Right down really hard. Perfect. Cranial nerve 2 is intact. Cranial nerve 5 is intact. Was there any tenderness?
No.
Okay, good. Let's go to eyes. All right, eyes are symmetric. Eyelid color is normal for ethnicity. Eyelash growth is upward. Lower eyelid lash is downward. All right, look around your eyes. Good, no protrusions. All right, I'm just gonna shine a light in your eyes. Just look at me, okay? All right, perfect. Perla is intact. Pupils round. Reacted to light. Accommodate. Cranial nerve 2 is intact. Let's do extraocular muscles, okay? All right, perfect. Cranial nerves 3, 4, and 6 are intact. Extraocular muscles are intact. All right, I'm gonna feel your lacrimal apparatus down here, okay? Any tenderness?
No.
I'm gonna put it on your lower eyelid. All right, perfect. Conjunctiva is clear, sclera is white. Iris are hazel with no markings, and cornea have no markings. Okay, let's do the visual fields of acuity, okay? Can you hold this about 14 inches from your face? Close your right eye. What's the lowest side you can read?
8.
All right, other eye.
8.
All right, perfect. Visual fields of acuity are intact. Cranial nerve 2 is intact. 20/20 vision. All right, next let's do confrontation test. I'm gonna swing my arms around your face. You just tell me when you see them, okay?
No.
Okay.
No.
Okay.
No.
Perfect. Cranial nerves 2 and 3 are intact. Next, I would do the red reflex, which is where I would get the ophthalmoscope and look inside your eyes just to make sure that blood vessels are going towards your optic nerve and that your macula is a creamy yellow. We're not going to do that today, but cranial nerve 2 would be intact. All right, let's move on to ears. Ears look pretty symmetric. I'm going to feel. Any tenderness?
No.
Okay, perfect. No tenderness noted. I'm just going to take a look at them, okay?
Okay.
All right, let me do the other side. All right, perfect. Okay, no cerumen, no redness, no tenderness, no swelling, no dried exudate, no foreign bodies. Normally I would look inside of the otoscope and I would note that your tympanic membrane is a pearly gray and that I would know what degree your cone of light is in. We're not gonna do that today, but that's what I would do. All right, let's do the whisper test. All right.
Rat, tat, tat.
Okay, I'm gonna do the other side.
Rat, tat, tat.
Okay, perfect. Cranial nerve 8 is intact. All right, let's go to nose. All right, just looking at your nose, it's pretty symmetric. Any tenderness?
No.
All right, let's test for patency. Put a finger up there on blow in and out. All right, other side. Perfect. Patency is intact. I'm just looking. All right, nasal mucosa is pink and moist. No dried exudate, no bleeding, no tenderness, no swelling, no foreign bodies. Everything looks normal. I'm gonna feel for your maxillary and frontal sinuses. You just let me know if there's any tenderness, okay?
Okay. No.
Okay, no tenderness noted. All right, let's move on to mouth. I'm not actually gonna perform this exam. I'm just gonna explain what I would note, okay?
Okay.
Lips are pink and moist. Oral mucosa is pink and moist. Teeth, I would note if there's any misshapen, deformities, ulcerations, missing teeth. Then I'd feel your gums and I'd say no redness, no swelling, no tenderness, no ulcerations. I would note that the top of your tongue is rough, the bottom of your tongue is smooth, the sides of your tongue are smooth. Then I would elicit your gag reflex with the tongue blade. While doing so, I would note that your tonsils, your uvula, the symmetry of your hard and soft palate, and then I would note the gag reflex is cranial nerves 9, 10, and 12. Moving on, let's do neck. All right, your neck looks pretty symmetric, no deformities or anything. I'm gonna just do all your lymph nodes. You let me know if there's any tenderness, okay? Preauricular, postauricular, tonsillar, occipital, submandibular, submental, superficial cervical chain, posterior cervical chain, deep cervical chain, supraclavicular, infraclavicular.
No tenderness.
Okay, no tenderness noted, no enlarged lymph nodes. All right, next I'm gonna feel for your trachea. Okay, trachea is midline. Now I'm gonna do the thyroid test. I'm gonna put both my arms around your trachea. I just need you to swallow, okay? Swallow. Perfect. All right, no enlargement of the trachea. I'm gonna go ahead and feel for your carotid arteries. All right. All right, perfect. Carotid arteries 2+ bilaterally. All right, I'm gonna check my card. Go ahead and pull your shirt off so I can do your lungs. All right, I'm just gonna take a look at your lungs. Chest wall is symmetric, rises and falls. No use of accessory muscles. Everything looks good. I'm gonna palpate. You just let me know if there's any tenderness, okay? Other side.
No.
Okay, no tenderness, no crepitus. I'm gonna do something similar. I just need you to say 99 while doing it.
99, 99, 99, 99,
Okay.
99, 99, 99, 99, 99.
Perfect. Tactile fremitus is intact. I'm just gonna percuss, okay? All right, let me do the other side. Resonance heard throughout. Alright, I'm going to do your CVA tenderness. You just let me know if there's any tenderness, okay?
No.
Okay, perfect. No tenderness noted for CVA. Alright. I'm going to listen, okay? Let's first start with your carotids. I'm just going to get you to hold your breath. Take a deep breath in and hold it, okay? Let it out. Other side. Perfect. No bruise noted at carotid. Alright, I'm gonna start with your trachea. Just breathe normally. Alright, bronchial, bronchiovesicular, vesicular. Let me do the back. Alright, perfect. Lung sounds clear throughout. Alright, now let's move on to cardiac. Alright, I'm just gonna listen, okay? Gotta listen with the diaphragm first. Aortic, S2 greater than S1. Pulmonic, S2 greater than S1. Herbs, S1 equal to S2. Tricuspid, S1 greater than S2. Mitral, S1 greater than S2. Alright, now we're gonna do with the bell. Mitral. Tricuspid. Herbs. Pulmonic. Aortic. Alright, good. S1, S2. We're heard throughout. No adventitious heart sounds, no murmurs. Alright, I'm gonna get you to lay on back. Let's do that. Alright, first one I'm gonna do is just listen, okay? Alright, normal active bowel sounds heard. Now let's do test for bruise, okay? When I do this, just take a deep breath in and hold it, okay? Aortic. Alright. Renal. Let it out. Other side. Renal. Alright, you can let it out. Do your iliac. Alright, other side. Alright, let me do femoral. Alright, other side. Alright. No bruise heard throughout. I'm just gonna note that your stomach contour is rounded, no dilated vessels, no enlarged veins, no bruising, no striae, everything looks okay. Alright, now I'm gonna percuss throughout, okay? Tympani heard throughout. I'm just gonna do your liver, okay? Alright, tympani to dull heard throughout. I would say liver is approximately 7 to 10 centimeters. Now I'm gonna go around on the other side and I'm gonna do your spleen, okay? Alright, spleen was dull throughout. Alright, now I'm gonna lightly palpate. You just let me know if there's any tenderness, okay?
No.
Okay, now I'm gonna deeply palpate, okay? Alright, on light palpation, there was no tenderness, no masses. On deep palpation, there was no tenderness, no masses. Now I'm gonna try to palpate your liver. Just take a deep breath in and let it out. Alright. Let's for your kidney, let's do your spleen. Alright. Alright, now I cannot palpate liver, spleen, or either kidney. Alright. Go ahead and sit on up for me. Let's start doing range of motion stuff. Like this one. Alright, before you get up, I'm gonna feel for shoulders, elbows, and wrists. Was there any tenderness? Okay, I'm gonna do your brachial. Alright, do your radial. Okay, brachial. Radial. Alright, 2+ bilaterally at brachial and radial. There was no tenderness?
No.
Alright, go ahead and stand up and walk to the door and stand over there for me. Alright, gait is fluid. No struggles. Yeah, go ahead and turn that way. Can you bend over just a little bit? Alright. No palpation of spinous processes, no scoliosis or lordosis. Alright, let's do range of motion of spine first. We're gonna twist, bend at the hip, bend at the hip. Alright, good. Full range of motion of spine is intact. Alright, let's do shoulders. We're gonna flex the shoulders, extend the shoulders. We're gonna abduct the shoulders. We're gonna adduct the shoulders. Perfect. We're gonna externally rotate, internally rotate. Perfect. Full range of motion of shoulders is intact. Let's do elbows. Flex the elbows, extend the elbows, supinate the elbows, pronate the elbows. Perfect. Let's do wrists. Can you flex the wrist, extend the wrist? We're gonna abduct the wrist. We're gonna adduct the wrist. Perfect. Full range of motion of wrist is intact. Full range of motion of elbows and shoulders are intact. I would normally do deep tendon reflexes at the bicep, tricep, and brachioradialis, but we're not gonna do that today. So you can go ahead and hop back up here for me. Let's do lower extremities, okay? Perfect. I'm gonna pull this out and I'm just gonna lay you back. All right. First I'm going to go for your femoral, okay? All right, other side. All right, femoral is 2+ bilaterally. I'm gonna feel for any inguinal lymph nodes. You just tell me if there's any tenderness, okay?
No.
Okay, other side.
No.
Okay, perfect. No enlarged lymph nodes. All right, next I'm gonna feel for your popliteal. All right, other side. Okay, 2+ bilaterally. Now let's do dorsalis pedis. All right, 2+ bilaterally. Let's do posterior tibialis. Okay. All right, perfect. 2+ bilaterally. Okay, let's start with range of motion of hips, okay? We're going to flex the hip, extend the hip, abduct the hip, adduct the hip. We're going to externally rotate, internally rotate. Any tenderness?
No.
Okay, let's do the other side. All right, we're gonna flex the hip, extend the hip, abduct the hip, adduct the hip. We're gonna externally rotate, internally rotate. Any tenderness?
No.
All right, full range of motion of hips are intact. Let's do knees. All right. We're gonna flex the knee, extend the knee. We're gonna abduct the knee. We're gonna adduct the knee. Is there any tenderness when I touch?
No.
Okay. We're gonna flex the knee, extend the knee, abduct the knee, adduct the knee. Any tenderness when I touch?
No.
All right, full range of motion of knees are intact. All right, we're gonna dorsiflect. We're gonna plantar flex. All right, we're going to evert the ankle. We're gonna invert the ankle. Evert the ankle, invert the ankle. Any tenderness when I touch your ankles?
No.
All right, perfect. Can you push up on my hands for me? All right. Can you push down on my hands for me? Perfect. Full range of motion of ankles are intact. Lower extremity strength is intact. I would normally do deep tendon reflexes at patellar and ankle. We're not going to do that today, but they would be 5 out of 5 bilaterally. Can you put your arms up like this? They'll only push you or pull you, okay? All right, squeeze my fingers as hard as you can. All right, perfect. Upper extremity strength, 5 out of 5. Grip strength is 5 out of 5. All right, let's move on to some sensory stuff, okay? All right, we're gonna start with pain and light touch. All right, this is pain, this is light touch, okay? Close your eyes.
Pain. Light touch. Pain. Light touch.
Okay.
Pain. Light touch. Light touch. Pain. Light touch. Pain.
All right, pain and light touch are intact. All right, let's do positioning. See hands?
Up. Down.
Okay, close your eyes.
Up. Down. Down. Up.
All right, perfect. Positioning is intact. All sensory movements are intact. Let's go to coordination. Can you put your hands on your lap and just flip them like that for me? All right, good. Now put your finger to your nose to my finger. All right, perfect. Now, I need you to hop down and let's do the Romberg test, okay? All right, you're just gonna stand really still and close your eyes, okay? All right, all coordination movements are intact.